pounds, 25 to 35. So if you're obese, you gain up to 25 pounds. If you're a teenager or underweight or reverse multiple penises, you gain more than 35. So again, the best predictor is a gradual, regular pattern of weight gain for all neural defects. What's true of neural defects?
Yes.
Directly related to poor maternal status of folate. Once given birth, there's no correction that can be made to spina bifida. And it's happening during the critical development period, so there's no recovery with better nutrition in the last trimester. So that concept of critical development period in the first trimester is best illustrated by what? All of them. So if you chronically drink, heavily drink during your pregnancy, you can give birth to a baby with fetal alcohol syndrome. If you're a pregnant teenager and you yourself have poor diet and then that will affect the development of the fetus, it's a good chance you're going to give birth to a baby over their age. If you were deficient in folic acid before your pregnancy, then good chance of giving birth to a baby with spina bifida. What are the metabolic disorders or complications during pregnancy and or delivery? Actually, all of them. Which two have the same treatment recommendations? Small, frequent, dry meals. Morning sickness and heartburn will treat. Having small, frequent, dry meals will treat morning sickness and heartburn. What's another term for eclampsia? More common term. What happens to your blood levels because of the high blood pressure? Pregnancy-induced hypertension, right? And the other more common term is toxemia. So because you have pregnancy-induced hypertension, your blood pressure is very high. There's toxins build up in your bloodstream. That's why they refer to it as toxemia. And edema is a very distinguishing characteristic. And you need medications, you need bed rest, and you may probably need to be induced early. There's no dietary treatment for pregnancy-induced hypertension. It's all has to be medically managed. So the condition where women give birth to a baby with characteristic facial distortions and features because of consuming alcohol during their pregnancy is the fetal alcohol syndrome. So either you, even if you socially drink, especially after the first trimester, the critical development period, you can still have a baby with the fetal alcohol effects. So when is breastfeeding recommended? Right. Always, 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 always. Always recommended. So it will help with the development of the jaw and the speech, and the only way to decrease allergies is because of the provision of antibiotics. surplus iron stores, and they're just fine with breastfeeding or preferably or formula feeding. Breastfeeding should always be encouraged over formula feeding, even if you're working or not. And remember, unprocessed cow's milk, chocolate, egg whites, all of those should be avoided until the baby's at least a year old, is the high risk for allergies. Given the incidence of heart disease in the U.S., a fat-modified diet initiated during infancy is wise. What organ is in key development that you would be compromising its growth, that needs fat? The brain, chiefly, and then the nervous system. So not until they're at least 2 years old should you be restricting fat. Two major organs, the brain and the nervous system, need fat for development. What should you do to encourage a child to try new foods? I'm the fairy godmother, Anne. Actually, not